Your doctor has recommended a diagnostic cardiac catheterization. Here is what this test actually involves.
Catheterization uses thin, flexible tubes guided into the heart to measure pressures and image blood vessels directly.
It is minimally invasive. No chest is opened. Access is through a small puncture in the wrist, groin, or neck. Cardiologists commonly order this test to check the coronary arteries, valve disease, heart failure, or pulmonary hypertension. Before the test, doctors check blood work, kidney function, and current medications. Fasting is required for several hours. In the Cath lab, most adults receive conscious sedation. You stay awake but relaxed, with the skin numbed at the access site. Under X-ray guidance, the catheter travels through the blood vessel to the heart. Blood vessels have no pain sensors. Contrast dye is injected, so arteries appear on X-ray. Many people feel a brief warm sensation that quickly passes. The team measures pressures inside each chamber, samples oxygen, and records how blood flows through the heart. A straightforward diagnostic study usually takes 30 to 60 minutes. Afterwards, the catheters are removed and the site is closed. Recovery is usually quick. Many patients go home the same day and return to office work within 1 to 2 days. In children, the test is done under general anesthesia by specialist pediatric teams, using smaller catheters and careful dosing. Serious complications are uncommon in experienced centers. Minor bruising at the access site is the most common issue. The test does not always lead to surgery. Results may confirm that medication or watchful management is the right path. Did you know you can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost?
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.